The next module is TRAZER'S Concussion Management Module. What the Concussion Management Module does is allows you to take a healthy baseline of an athlete or a student or professional athlete for that matter and incorporate an exertional protocol rather than a sedentary neurocognitive test. The baseline test incorporates the Balanced Error Scoring System, or BEST test, which is done on firm and then soft using a balance pad. Then it goes into an exertional protocol. The first one is the graded test 30. So much like the senior module, it's the same activity, but you ramp up at 1 foot per second every 30 seconds rather than 1 foot per second every 2 minutes, moving in multiple directions. You use a dual task paradigm, so you have to maintain your speed, engage the targets, and also ensure that your heart rate gets up to 80-90% of max heart rate while you're doing this activity. Then it goes into the lateral speed, again going side to side, isolating those limbs further to identify asymmetry of movement. Lateral speed to maintain the heart rate, and then jump 360 to exacerbate the vestibular system. So the jump 360, you just stand in place, you jump 180 degrees, jump 180 degrees. You do that 10 times, moving in the same direction to get your head spinning, and then it's followed by a post-exertional balance test. Then a comparison is done between the pre-exertion and post-exertional balance test to determine the deviation. It should be fairly similar if a person isn't concussed or doesn't have a vestibular problem. If there's a wide deviation between the pre and post-exertional balance test, it could be indicative of concussion or a vestibular issue with the individual.